Hi, it's Dr. Andrew Markey here again. I'm going to talk on something that a few of you asked questions about, which is what might you expect if you have a dermatological consultation? Well, I guess the first problem is, how on earth do you know in this wild west of medicine, do you know that you're actually seeing a dermatologist? And this, of course, varies across the globe in different countries. Speaking in the United Kingdom, if you want to speak about a dermatologist specifically, the way you must do this is by going on the internet to the General Medical Council's webpage. And on the top, you will see a little bit of text that says, check our registers. And if you click on there and insert the name of the person, it's got to be exactly correct, the spelling. It's not clever like Google. If you misspell by one thing, it will deny the person. You've got to spell correctly. If you insert the correct spelling of the person and press enter, it will tell you if that person is a doctor, if they are on the medical register. And you might think that's enough. But if you want to find out if they're actually a dermatologist, and that means that they've had 4 to 5 years of general medical training after leaving medical school, and then done at least 4 further years in specialist dermatology training, you have to click on another register, which is called the Specialist Register. And if you click the name of whoever's come up on the general register, if you click on the Specialist Register, you will see a little square box come up. It stands for Specialist Register, and under that it will say Dermatology Specialist Register. So those 2 steps, are you on the General Medical Register first? Secondly, are you on the Specialist Register for Dermatology? If you have a tick against both of those things on the internet, only takes a couple of minutes, then the person you're seeing is a dermatologist, and therefore they have got the highest training in specialist knowledge of your skin. Of course, there are excellent other healthcare practitioners, such as prescribing pharmacists, nurse practitioners, general practitioners. There are other excellent healthcare professionals, and some of them will be excellent sources of information for your skin. But if your first priority is to see a dermatologist, then you need to go through the Specialist Register of the General Medical Council to know. Anybody can call themselves a super injector, a specialist cosmetic doctor, various great adjectives around, but dermatologist is not a legally protected title. You have to check on the General Medical Council register to see if they're on the Specialist Register. So that's the way to find out what has been the training of the person that you might go to see. So what might happen during your consultation? Well, it'll be a medical consultation consisting of taking a history, your story, and also examining your skin in different types of lights. And resulting from that will become a judgment made by the dermatologist on the issues that concern you. So it's good to arrive with a list of questions and concerns, and also a photograph sometimes can be helpful, because in some dermatological issues they're not always there continually. So if things flare or get bad, always take a picture on your phone when it's particularly bad. And then your options will be explained by the dermatologist, taking into account their training and their judgment, and the risks and the benefits, as well as what's involved in the particular procedural techniques required, will be discussed. You shouldn't be put under any pressure to undergo any specific treatment, and if you need time to reflect, that's always a great thing. Alarm bells and red lights may obviously be fired off in your interaction with the person. Somebody who's a consultant dermatologist, gone through the whole training program and then been appointed as a consultant to a definitive post, often in a teaching hospital or a district general hospital, will not be interested primarily in getting your money if you're doing this privately, or getting you out of the clinic if you're in the National Health Service. They will be devoted to trying to diagnose and deliver the best treatment humanly possible. Any hint of a hard sell, or you not feeling that you're being listened to, should be an alarm bell to say thank you very much and walk out. And to this point, therefore, talking about feedback from your peers, from your friends, is a great first place to start, rather than an advert as to who you might go to see. But do remember that the first and most important thing is to understand, are you seeing a pharmacist, a physician associate, a nurse practitioner, a general practitioner, a generally trained doctor, or a specialist trained dermatologist, or a specialist trained plastic surgeon? There are good practitioners in all these groups, but the most important thing is to understand the training of the person that you're sitting down in the first instance. And the other most important thing is to develop a feel for, if something were to go wrong, and of course things do go wrong in medicine, you want to know that the person who you are seeing is on your side as your advocate and is going to do everything possible to put it right. That is so important. So you feel that your colleague, the professional colleague that you're putting your trust in, is always going to be on your side. So hopefully that's given you some general pointers, and your gut feel, your subconscious, is always worth listening to. Decide if this is the sort of person to develop a professional relationship with. So if your gut says walk, it's a good guide. Walk out, because there's somebody who you will feel has got your best interests in heart round the corner to see. So I hope you found that interesting and important, and do visit the General Medical Council's training pages to understand who is or who isn't on various specialist training registers. Not to exclude people who are not, but to understand what their specific training has been. Because nowadays you can pretty much claim anything for yourself, including a title of dermatologist.